Welcome. I'm Amy Ronshausen. I'm the Executive Director of Drug Free America Foundation and the International President of the World Federation Against Drugs. On behalf of both organizations, I'd like to welcome you to our side event, Global Prevention Practices and Policies During COVID-19. And I also want to welcome and acknowledge our awesome co-sponsors. We have Movendi International, the Turkish Green Crescent, WFAD, and the Uganda Youth Development Link. I'm very appreciative to all of you that have signed in today. I understand that you have many virtual invitations, especially this week. So thank you for taking the time to join us to hear from our great lineup of speakers. Before I get started, I'll go through just a single housekeeping item, although I'm sure you are all pros at these Zoom meetings by now. But please use the question and answer box for any questions that you have. We should have some time at the end to answer a few of them. So just go ahead and type them in. And once all the speakers have finished their presentations, we'll go back and review what's there. I think we can all relate that this year has been different from what we are used to, especially when it comes to meeting for CND. We have been challenged both personally and professionally this year. Our mental health, physical, spiritual wellness has all been pushed to the limits and then some. But what many of us here today have in common is that from the very start, we understood that this pandemic was going to have a major impact on the global drug crisis. Previous research demonstrates that substance abuse as well as deaths related to drug and alcohol use can increase during times of social and economic upheaval, and that is what we are experiencing now. Measures put in place to combat this pandemic, such as our shelter-in-place orders, have been associated with negative emotions such as irritability, anxiety, fear, sadness, anger, and even boredom. These conditions often initiate drug use, can trigger relapse, even for those in long-term recovery, and can intensify and increase drug consumption rates. In addition to being a possible catalyst for drug use, the pandemic has caused limited medical assistance for substance use disorders because most medical efforts right now are geared toward COVID-19. Shelter-in-place orders have pushed everybody into somewhat of an isolation in some places of the world more than others. And this has led to a decrease from access to different prevention programs and efforts, and certainly some treatment services, as well as healthy outlets that we used every day to avoid different risk factors and activities that provided a distraction from addiction. Individuals on medicated assisted treatment had difficulty getting that medication in many parts of the world, which increased their risk for relapse and overdose. And while the pandemic has thrust us into uncharted waters, drug demand reduction professionals all over the globe continue to meet the challenge. And it really is impressive to see the different things that everybody is doing and how a renewed commitment to be there for people and these issues. Today, we're going to hear from some of those global prevention and policy experts on how they have adapted their strategies to meet people where they are at, and how advocating for policies that put public health first and a commitment to research remains a priority. So I'm not going to read all of their wonderful bios, and I will send a link to all of our attendees after this that links to their organization, so you can learn a little bit more about them and their organization. But for purposes of time, I'm just going to introduce them and let them use that period to speak on their topics. We figured that's more important. So it is my great pleasure to introduce our very first speaker, Mike Doonbeer, who is the Director of Strategy and Advocacy at Movendi International. Mike, the platform is yours.
Thank you so much, Amy. And good morning from me. Amy, this was a fantastic introduction. I feel like you have touched upon all the points that I want to raise here for the context of alcohol prevention. So thank you very much for having me. It's a real honor also, as you said, Amy, to be together this morning with all the other expert speakers and participants from around the world here's what I want to share with everyone in the next 10 minutes. I'll just use one slide to introduce Movendi very quickly, and then I want to talk about 3 dimensions when it comes to the lethal interaction between alcohol and COVID-19. I want to look a little bit more specifically at the alcohol industry as determinants of health, and then draw out some conclusions and some lessons learned along those lines that you outlined, Amy, how we have adapted, but also how our environment, our societies have changed on this interaction between alcohol and the coronavirus crisis. So I want to speak a little bit about prevention and alcohol prevention in this pandemic. Let me just tell you that in Movendi International, we address alcohol and other drugs as obstacles to development on 4 levels. So the individual, the community, the societal, and also the global level. And we are the largest global social movement addressing alcohol and other drugs from this development and health and human rights perspective. And as Amy said, I'm happy for you to check out our website and to get in touch if you want to learn more about us. One of the things that we are doing, we think it's quite unique, is a new center that we are running with daily updates. And that has been a cornerstone of our work in the last year. So we have invested even more efforts in news stories and scientific articles, unique blog posts and opinion pieces, and also promoting community solutions when it comes to alcohol and other drugs harm, and what best practices are actually out there. And from this work, you know, it's not just about writing it, it's also about monitoring the policy landscape, documenting what the alcohol industry is doing, for example. So from this work, I think we gain lots of insights, and we have challenged ourselves also to actually adjust to this situation with the coronavirus crisis that, as Amy has so well explained already, has really put us all into very challenging situations. To explain the challenging situation when it comes to alcohol and the coronavirus pandemic, we have worked with a group of leading researchers in the area of alcohol control, and issued a report, Alcohol and the Coronavirus Pandemic, Individual, Societal, and Policy Perspectives. So this is very new. It came out in the end of January. And I think if we go through this very quickly, we understand both lessons for prevention, the potential for prevention, and the potential of civil society actions in this whole context. So I'm talking to you for the next few minutes about alcohol's role in the pandemic, but also how the pandemic, as Amy already alluded to, is impacting alcohol and other substance use and harm from that, and which policy responses we are seeing or we are not seeing, and what it is that we are working for. So let's start with alcohol's role in the pandemic. There are actually 3 dimensions to this. So alcohol is an immunodepressant, so it actually weakens our immune system functioning. So physiologically, on the individual level, alcohol has this detrimental effect, even negatively interacting now with the body's ability to receive the vaccine and to process the vaccine. But there is also the health system functioning. So for us, it's very interesting that it's the immune system on the individual level and the health system on the societal level, where we can see that even before the pandemic, on average, alcohol contributed to 20% of injuries and 11.5% of all non-injury emergency department presentations. So that is a major burden that alcohol puts on our healthcare and emergency services already before the global public health crisis that we are now seeing. And I think then we are all struggling with this situation that our societies are actually not able, don't have the capacity to help every COVID patient as they should. So I think that really highlights the potential of prevention already before a crisis, and then of course also during this crisis. alcohol also interacts with the pandemic in actually fueling super spreader events. So we have seen in the previous year up until now that alcohol-centric social contexts very often have become super spreader events and have forced governments to actually address alcohol availability as a part of curbing the coronavirus pandemic. Then Amy has already mentioned it, and I will just focus on one aspect here. Then the pandemic in turn also fuels alcohol use and harm. And for example, we can see that violence and calls to hotlines for help, both from children, but also from women. So very often domestic violence is increasing, also fueled by alcohol. And the situation is of course more severe because victims don't have anywhere else to go. So here it's very clear also what the potential of prevention can do and actually is. So that means environmental prevention, but also community-based prevention to serve at-risk communities. And that brings me to the next part here, the policy responses or the lack of policy responses, because not all of our governments are actually interested in or committed to acting in the spirit of prevention and public health, even during a global public health crisis. So we have seen that some countries have instituted temporary alcohol sales bans, but other countries have actually made it more easy to deliver alcohol, have made alcohol more widely, more easily available. So they have weakened the rules around online sales and on-demand delivery. And we can see here that this has put children and young people at even greater risk. They have now access to alcohol that they didn't have before. So this situation are actually real life experiments during a global public health crisis that shows the potential of investing in preventive measures like regulating alcohol availability more, or not investing in preventive measures, and what that means for individual health, health system functioning, and then of course population health as such as well. The researchers in the report, they make a number of recommendations, and I just want to highlight two of them for our context today. They really recommend governments to limit alcohol availability and affordability, and to make use of evidence-based alcohol pricing policies. So in countries around the world where governments have chosen to use these measures, the effect has been very positive. As I said, it's like a real life experiment, and the data we can see is that this helps both in the COVID response, but also of course the health of the people, for example, in reducing and preventing violence. But they also recommend, or not but in addition to this, they recommend to make clinical treatment and treatment provisions for people experiencing all types of alcohol-related problems. So some people, heavy alcohol users, they have actually increased their use. They have transitioned to use disorder and maybe even addiction. And as everybody knows, even before the pandemic, we didn't have enough treatment options. We didn't have good enough services to cover all the need out there. And so I think this conversation about preventive measures like alcohol pricing policies in combination with then using government revenue to actually invest in treatment and mental health services, this is so important. This is one of the big lessons from the pandemic that has brought this into sharp focus of what should be done and where the resources should come from to actually help people that develop problems. So as I said, it's interesting to just reflect that this is a system problem when it comes to the immune system and the individual and the health systems of society. So this is what all our governments, all our countries have in common. And that should really put the spotlight on the potential of prevention and the importance of the work that many of us are doing in communities around the world. Unfortunately, there is an opponent to this kind of prevention effort, and that is the alcohol industry. They have actually used the crisis to advance regulatory changes, weakening all kinds of alcohol policy solutions that are already in place. So they have now found the opportunity to advance their decade-old agenda. And so to round off, I have 2 more slides. And what we are finding as a social movement around the world is that we have actually done more of everything. I think looking at this reality that we are facing, we needed to do more advocacy and support more of our governments and civil society activists to advance these alcohol policy solutions with the preventive potential. We had to step up our work to monitor, document, and expose the unethical practices of the alcohol industry, exploiting this kind of crisis. Of course, as Amy alluded to, we have to do more work in supporting vulnerable people, for example, through our physical distancing coping kit. And then we have done more events, actually. So events that promote and support alcohol-free choices. As you can see that this helps mental health and coping techniques. So, and that means also more community work as much as that was possible. And so the lessons we have learned is that we are actually facing a crisis within a crisis, and that prevention in combination with mental health and treatment services is really important to build back better from the coronavirus crisis and to address the addiction epidemic that we see. I think the potential of environmental and community-based prevention is very clear, is very obvious, but we have to take it as a challenge for ourselves to give voice to this, to tell the stories, to show the evidence, and to translate evidence into action, for example, in terms of improving health system functioning and to yield returns on investment in prevention. Now, this should be very clear. I have mentioned the importance of really exposing the exploitative business practices of the alcohol industry. And what we are very proud of, what I think others will also speak to today, is that civil society organizations and community-based organizations really are the nervous system of our societies in this crisis situation, bringing important services, important information, empowerment, and prevention to most at risk and most underserved communities. And with this, thank you very much. Thank you for having me, Amy. Over to you.
Thank you. Thank you for that great presentation. It really is so interesting, and I'm not going to lie here, a little alarming to see some of the different policy strategies that were put forward, especially by big alcohol during the pandemic here in the US, because we have so many states that have legalized marijuana. We saw some similar efforts with the dispensaries as well. So thank you, and thank Movendi for the work they're doing to track these policies, because like you mentioned, there are not a lot of organizations that do that, and for the work that you guys do to advocate for public health. It really is amazing. If you guys have typed in any messages for our speakers or questions, like I said, we will get to those at the end. At this time, I'd like to welcome our next presenter, Regina Mattsson. Regina is the Secretary General for World Federation Against Drugs, and I have the great privilege to work very closely with her. And I just think she's amazing and think the world of her. So Regina, I will turn it over to you.
Thank you so much, Amy. I'm just going to see here if my technical skills stand with me. Are you seeing the actual slide now or the notes?
The actual slide.
The actual slide. Perfect. Thank you, Amy. It's so nice of you to say that it's a pleasure, because I was going to say the exact same thing. It's a great pleasure to work so closely with you, and it's my honor and privilege to be here today to speak on the virtual collaborations and prevention work during COVID-19. So this is a nice little illustration of how globally connected we are at WFAD. We are a multilateral community of non-governmental organizations and individuals that stretch across the globe. We have members in all the regions of the world, which is fantastic. And we have now reached 310 member organizations in almost 60 countries. And we have a joint aim to strengthen prevention, increase access to treatment, and to promote recovery. And I should say that we adhere to the conventions on narcotic drugs, as well as the Convention on the Rights of the Child and the CEDAW. I just wanted to start by saying a little bit about the work that we and our members do before going into more of the prevention work related issues during COVID-19. So our members work within all areas of the field, and our secretariat, where I'm situated, deploy multiple projects together with our members. We have a project in the Western Balkans, which is the photo on the bottom there, in Belarus, two in Iran, East Africa, and the Democratic Republic of Congo. And these projects vary in focus, including early prevention and detection, support in leaving violent gangs, as well as treatment and recovery in various forms. So in 2020, at our General Assembly, which was right before the world went on lockdown, we adopted a 10-year strategic plan to focus particularly on the needs and the rights of women and children within our field. And it was an important step for our global network, as we have now stated our responsibility to address these specific issues and to ensure that they are made part in national and international policy, as well as implementation. And I know that this past year has been challenging for each and every one of us. And as we've strived to find new ways to cope and adapt to the new reality that COVID-19 has posed, we have also met new challenges, but also new fantastic ways to meet. And I know that ourselves and our members have done really new, innovative ways to meet the needs of our target groups. So throughout the year, we have, and I assume most of you have learned the skill of online meeting. And we spoke about this a little bit before we started, that although we've been to what seems like 1,000 different Zoom meetings, the first time you start and try a new platform, it's always a problem. But nevertheless, we've adapted to this new online environment quite quickly. And through our gender working group, we have had the luxury of following the developments of the work that's been done, as well as the COVID pandemic, of course, in different countries, including Nepal, India, South Africa, Pakistan, Nigeria, Italy, and Bosnia-Herzegovina. And through our members' meetings, which we've had with certain regions, we get closer to our members in these different contexts. We've also tried these virtual collaborations by offering campaigns, as well as webinar series on different topics. One of the largest one was on recovery, which we had 4 webinars on, and now we're planning to have one on prevention. And I wish we would have had that before this meeting, so I had a bit more best practice examples to share from our members. So what do we know about prevention? And I think Mike put it very well, so I'm not going to say what he has already gone through. But we do know that this pandemic has had a severe impact on people and has highlighted the existing inequalities that our world faces today. The virus itself and the lockdown measures have had different impacted different and various groups differently within our society. And 2 of these groups that have been severely impacted are women and children, to which I'll focus the rest of my presentation. So alongside the COVID pandemic, a so-called shadow pandemic has emerged. And this shadow pandemic is one of violence against women and children. And it's been highlighted by both UN Women and Save the Children alike. And it really showcases that while alcohol, drug use is increasing among the pandemic, so is the violence. So the information that we've seen in the World Drug Reports, both 2018 and 2020, is that, and it's something that isn't very unknown to us, but I think it's always important to highlight, is that violence is a contributing factor of substance use. And this includes childhood adversity, abuse, and even sexual assault in childhood and even later in life are all risk factors for developing addiction, and are also things, so to speak, that are common among women who use drugs in particular. So to prevent this, it's imperative that we address these issues in a comprehensive way and focusing not only on the determinants of addiction, but also on those of violence. So we know that some of this work can be addressed through prevention strategies, and in relation to women in specific and the need to focus on these issues, we have worked with our gender working group as well as with another organization, the Uganda International, in creating a way forward document, which is to be launched tomorrow. And this provides some valuable steps and tools in how to better meet the needs of women and women with children in our field. Apart from this, our gender working group has worked throughout the year in creating a type of knowledge base in how we can work with women within our field, and this includes everything from, prevention, treatment, recovery, advocacy as well. So it's important to keep in mind that prevention strategies are often tailored to men or boys, and these strategies then have little to no impact on women and girls. So we see, for example, that certain prevention activities within schools are not as effective on girls as they are on boys, whilst prevention in family and sort of community, family-based community has higher impact on girls. And of course, this also differs depending on, other intersecting identities that a person might have. So it's important that we ask and carry out more gender-specific evidence and research and have gender-sensitive interventions. So there's a lot of valuable work carried out and tested that happens in schools and communities, as well as within the homes. And the COVID-19, as we all know, poses a severe challenge in this respect, because as lockdowns in many countries have closed schools and hindered alternative pursuits and activities, it's also caused financial strains and kept children in their homes with families that sort of may face job-related and financial and other type of straining on their situation. And of course, this varies across the globe, but in general, millions of children have not been attending school for the past year. And according again to Save the Children, due to this disruption in children's education, this will result in about 10 million children not returning to school once the schools have reopened. And I mean, 10 million children is 10 million people are the amount of the population in Sweden. So it's a whole country filled of children that may not be attending school. And this affects children everywhere, and including children living in refugee camps, war zones, of course, and children with disabilities or children within other certain groups. So it's important that we as a global community and as a network call on governments to invest in reducing these barriers to learning for the most marginalized children, as well as make sure that their commitments through the Convention on the Rights of the Child are that they keep to this. So it's particularly alarming because we know that school is one of these protective factors that are something that we often look at when it comes to prevention activities. And it's, sorry, well, yeah. So I see that my time is running out, so I'm trying to skip a little bit here. I mentioned the Convention on the Rights of the Child, and I think this is important for us to keep in mind because it is the only human rights convention that specifically addresses illicit drugs, and it calls on member states to actively protect children from the use, production, and trafficking of these drugs. So using this article in the convention is a valuable tool for us in working for prevention among children, both on policy levels, but also on implementation. And just to mention something that we've done this past year, to make sure that we support children, WFAD has adopted the One Choice model, which has been created by our board member, Dr. Robert DuPont. This initiative suggests to stimulate and support the non-use of alcohol, tobacco, and drugs among adolescents, which is seen as a youth prevention initiative. Now, it's not meant to prohibit the use of these substances, but rather to inspire young people to voluntarily abstain from them. So the One Choice initiative is open for anyone to start living accordingly, whether they have or haven't used drugs, alcohol, or nicotine before. But by actively choosing not to consume any of these substances, this age group can limit moments of temptation and practice active decision-making when the substances are around. I see I'm running out of time, right, Amy? So yes, so I just want to highlight this. There's a lot of good toolkits around. Movendi are offering a lot of, like Mike has told us about, a lot of good publications. The UNODC has also made a good toolkit for how to parent during COVID-19, which is very important. And then, yes, this was meant to sort of highlight the need to also find new ways to reach people through digital matters, and not only those who always have the opportunity to have a phone around, but trying to find new means to reach children and young people through phones and campaigns. And we have a lot of members that are doing great work in this. So please visit our website to find out more about what our members are doing, and have a look at our members magazine for more information about what our fantastic members are doing in this time. Thank you, Amy, and sorry for going over time.
Oh, you're good. Thank you. Some of the things I was thinking about as you were talking is we've spoken to a lot of our colleagues from different parts of the world that have really worried and thought about that the pandemic has put back the work they've done on women issues and child rights issues, and has, you know, put that back a couple years of all the hard work they're doing. So I think that, you know, when we welcome ourselves back into the world, and we're going to be very happy to see each other in person, you know, sooner than later, I hope this issue isn't going away. These impacts are going to be lasting, and there's something that we're going to have to track over the next few years to see you know, what the outcomes are going to be. So you brought up some really interesting topics that we're going to have to keep an eye on and continue to work on and shift our strategies and policies. So perfect. So I will introduce our next speaker. Our third speaker is Rogers Kasari. Rogers is the Executive Director of the Uganda Youth Development Link, and he is also the Vice President of World Federation Against Drugs. Rogers is going to speak on how his organization has adapted to meet the needs of their community during COVID. And I am going to be sharing my screen to help Rogers with his slides. So let me quick do that.
Okay, thank you so much, Amy, and also the previous speakers, Mike and Regina, for what you have shared. If you looked closely at the title, the theme of this side event, Reframing Global Prevention Practices and Policies during COVID, there was an assumption that we've had conventional ways of doing things. And it looked easier. It looked a little bit easier to do it. But when COVID-19 hit us, we had to reframe, we had to revise, we had to revisit, we had to come up with new innovations of helping our clients so that our clients can cope and can be able to navigate through. And for us, for example, the organization which I'm representing, Uganda Youth Development Link, we work with young people in the slums who are homeless. We work with young people who are experiencing homelessness, young people who are using a lot of alcohol and other drugs. But we work with young people whose survival is very difficult. Without giving them a hand, survival will be very difficult. We work with young people who are coming from low-income settings in the ghettos, where opportunities are very limited, Amy, if you go to the second slide, you'll be able to see that our country is a country, Uganda, of young people, where almost 75% of our people are children and youth. So the need for survival, the dependency to depend on others to assist them is very high. But also we are coming from a country where we have a fragile health system. The system cannot meet everything. And unless somebody intervenes a bit, not much will be done. If you look at the third slide, I mean the third point, you will see that our welfare, social welfare, is not so essential like in your countries in the US, like in Europe. You people, you have a welfare system which can meet people. So we've got people who are living under abject poverty. And the second last break will tell you that they expect 3 million people to fall into abject poverty. In other words, the numbers will go up because of COVID. And this is the situation we are working in. And we have also been known to be a drinking country, a country where alcohol is cheaper than water, a country where every 5 people, 6 people, 4 people drink alcohol, and this is the country we are working in. If you go to the second slide, you'll be able to see that as an organization now, how do we respond? Because we've been operating in a drop-in center style, where young people come to receive services. I'll move a little bit fast, where young people come in to receive services. And every day we are receiving over 2,000 young people from the slums. Some are from the streets. Some are from, young people who are experiencing homelessness coming to our centers to receive vocational skills and also to receive other livelihood training. But when COVID hit, everybody is sent home. Everybody is sent home. You have people are scattered and staff cannot work. Everybody is working remotely. And you have young people who are experiencing slums. If you can experiencing homelessness, whose life is disrupted, and jobs emerge. Now, the challenges we see a decline in employment. Young people cannot get employment. In other words, no access to money. But also that means you have a disrupted consumption pattern and income loss and the severe mental illness with these people. Again, also we see children fleeing from homes because people are sitting at home, people are not moving. Then we see a spike in violence, but also we see young people who are homeless being hit and life becoming unbearable. If you go to the next slide, you'll be able to see that we begin to see situations of relapse amongst girls. Girls, now we see young people who have been survival crime, survival sex, survival exploitation, prostitution, adopting prostitution as a quick means of what to survive. We see increased transaction sex. But also now we see more people selling alcohol, drinking going up, and drugs because people are idle, people are not doing anything, people cannot go for services because everybody has been told to stay home. So we see an increase and a spike in drug consumption. Now, we have to reframe our response. If centers have been closed, people have been told to stay home, people don't have income, people have disrupted jobs and consumption. How do you respond? Of course, you move away from the drop-in center-based approach to household, to street-based, where you go identifying 1 or 1, 2, so that you can give counseling, you can give services. Again, also we see the need for cash transfers, where we have to give money, to the young people so that they can look out for short-term skills, for short-term interventions, which can help them earn money, be able to buy things, and be able to cope. The next slide will also show you that the issue of food distribution comes in. If people are not working, the jobs have been disrupted. Now you have to come in with food distribution, which you had not done before. And that's what it means to reframe the response. How do you move away from the traditional response to this one? Now somebody presents the food issue as very urgent need. But also we had to intensify referral, create awareness about COVID. They had an idea that you have to wash your hands, you have to do this. But in absence of sanitizer, in absence of masks, what do you do? We had to respond, but also we had to keep tracking young people who are experiencing gender-based violence and do referral. The next slide also will show you that we had to do advocacy and a lot of media talks on the radio about how children and young people living in the ghetto, living in the slums, how they can respond, how they can address issues of drugs, issues of alcohol, and where they can go for services, not in big numbers, but in small numbers. We have to give others temporary shelter because completely homeless and had nowhere to stay. We'll take them to our shelter and provide what? And provide the psychosocial support and talk about trauma, talk about counseling, but also to develop resilience and how do you adapt in such a situation which was unknown before. and what could we do? The next slide will show you that there are lessons we have learned out of this. If you go back, Emmy, a little bit, that there are lessons we've learned. One, it's important to involve the young people themselves. Emmy, move forward. It's important to involve young people. But also it's important to build a strong partnership with other actors because you cannot do everything yourself. But again, we had to harness technology, use telephones, use the telephone contact, to talk to the relatives, to talk to some young people who had phones, and do psychosocial support via phones. But also we had to prioritize prevention because this was an issue which we needed to do. We had to also empower young people so that they become, actual drivers, the service providers, and support their friends. We had also to ensure that children are kept what? Safe and healthy. You can see the number of young people whom we have served, as the screen is showing you. The young people who are experiencing alcohol and drug abuse. Next slide, please. But also some of the effects we show. Partner violence being reported. Rape also being reported. We see a lot of teenage pregnancy because of young people getting involved, and also abortions. Next slide, you'll also see some of the things on the photos. We had to give out a lot of, sanitizer and soap and distribute and work with government. We also had to give out a lot of food. Next slide. Next slide. We had also to give out food. We had to go to communities and walk individually. Our social workers had to go and give messages and walk. You cannot get closer. Young people cannot, meet in a big group, but you have to use microphones and go to communities and share with them about COVID. Also have to generate a lot of messages around gender-based violence, against alcohol, and thanks to our donors, particularly who responded. We want to thank OC, want to thank IOGTNT who supported us, and we had to readjust our proposals and our interventions in doing all this. I think this is how we have tried, and thank you so much to allow us to share, and we hope a few lessons have been captured out of this sharing. Thank you very much.
Great. Thank you, Rogers. Thank you for that look into what is going on in Uganda, and thank you for your global voice on this issue and sharing your expertise on all of this. Our final speaker is Sadef Erjatin. I think I said that right, but she will correct me.
Yes, it is. Yeah.
Who is the International Cooperation Supervisor for the Turkish Green Crescent. We've partnered with this organization in many places around the world, and I think that it is the perfect roundup to our side event today. So I will go ahead and give it over to you.
Just a second. Let me share my screen first. Okay. Again, technical issues. So.
Is there anything I can do on my end to help?
Can you hear me?
Oh, yep, I can hear you now.
I am back. I am back. There was a technical problem, I think, when I was sharing my screen.
Okay.
The Zoom got closed. Let me try again. Sorry.
No, that's
for-
okay. I wasn't sure if I froze or if it was on your end.
Yeah, this is the situation we are
Perfect.
facing with the COVID and Zoom period also.
Yes,
Unfortunately.
it was bound to happen.
Yeah. Okay, so can you see my presentation? Is everything fine?
Yep, you're good to go.
Okay, thank you. First of all, many thanks, Amy, for great moderation, for inviting us and organizing such an event. And it's really great to be here with other distinguished colleagues who already shared their expertise and the kind of cautious and prevention services they did during the COVID-19 period. As you briefly mentioned, I work as the International Cooperation Supervisor at Turkish Green Crescent Society, an independent nonprofit NGO founded in Istanbul in 1993. It works for the protection of the society and particularly the protection of young people from substance abuse and other risky behaviors. I will briefly talk about how we adapted our prevention and recovery services during COVID-19. Undoubtedly, COVID-19 pandemic has brought major challenges to healthcare systems and public health policies globally. It requires novel treatment and prevention strategies to adapt for the impact of the pandemic. Moreover, social and economic changes caused by the pandemic, along with the traditional difficulties regarding treatment access and adherence, have certainly worsened during the period, therefore aggravated their condition. In that sense, scientific strategies for prevention and treatment must be discussed and reshaped. So, prevention and substance use, I won't go in details, but substance use is a process that includes many different pathways that doesn't have one simple cause. It is mostly driven by the decision influenced by internal biological factors and external environmental and social factors. While drug use can increase the risks associated with the coronavirus infection, the social and psychological risks of pandemic can favor and intensify drug abuse potentially catastrophic cycle. Social distance, isolations, or quarantine are essential measures to help to prevent coronavirus transmission. However, these strategies and the pandemic outbreak itself have been associated with negative emotions such as irritability, anxiety, fear, sadness, anger, and boredom. So, what are the protective factors? Protective factors, or those that can reduce the vulnerability of individual, are characteristic of that offset or buffer the impact of existing risk factors. So, what is prevention? I won't go in detail with this slide because my colleagues, both Mike, Regina, already mentioned about the prevention and prevention models, and but prevention is essential because we know that addiction is preventable. The most prominent example of this is the American soldiers who fought at the Vietnam War, and then the only thing I want to mention is prevention is cost-effective too. We know that for every dollar spent on prevention, at least 10 can be saved in the future health, social, and crime. So, you may see the level of preventions here: universal, selective, and indicated. And as Turkish Green Crescent Society, we place high emphasis on the early prevention strategies, where universal, selective, and indicated prevention strategies are implemented at the earliest because the relationship is developmental. Prevention can prevent the spiraling of behavioral problems in those beginning early by making the individual less vulnerable to the problems in later stages of the development. We also know that children and adolescents whose brains are still developing are particularly vulnerable to substance use. So, What has the pandemic altered in prevention needs? We know that people tend to use substances such as alcohol, opiates, and cannabis to deal with stressful emotions and situations such as COVID-19 pandemic. It is also estimated that the number of patients who can receive addiction treatment has decreased due to the restrictions introduced within the scope of COVID-19 measures in addiction treatment centers. And just during this period, Green Crescent counseling centers continue to provide support to counselees intensively. Between March 2020 and July 2020, online support was provided within the scope of the COVID-19 measures. Since the beginning of the epidemic, the number of calls received in the hotline for alcohol and substance abuse treatment is over 13,000. A total of 195 psychologists and social workers provide support in the hotline and provided the necessary guidance for treatment. Currently, face-to-face and online interviews continue with clients and their families. In the process of the online therapy application, techniques applied in face-to-face interviews at these centers were adapted to online interview applications. All employees were informed about the online therapy, and total of almost 8,000 online therapy, and then over 4,000 social service counseling interviews were held since March 2020. So you can see also the statistical data here, but we have done online through our Green Crescent counseling centers in the COVID period. And then this was not the list, as Green Crescent has highly active on social media and other online platforms since the beginning of the pandemic. Between March and June 2020, we broadcasted 16 live sessions on Instagram on a wide range of issues, from healthy nutrition to at home and searching for the meaning in life. We chose these different types of channel considering different types of society, like young people and like women are using this program. We also check the analytical data. When we are deciding the channel, we are doing the broadcasting. With the COVID-19 outbreak, it has been observed that people's anxiety levels has increased around the world. According to the online survey made in Turkey with 422 people, anxiety mean score and the average rate anxiety score was found to be 51.93 and 43.03 respectively. And the anxiety scores vary according to the gender, marital status, employment, and whether their relatives have had COVID-19. All groups, except for those whose relatives have not had COVID-19, were found to have higher state of anxiety. The World Health Organization stated in a report published on March 18, the general population's concerns about the mental health. In the meta-analysis study, which examined 17 studies with a total of 64 participants, it was stated that almost 33% of people worldwide experience anxiety due to COVID-19. Here are the percentages of the stress, anxiety, and deep sadness with which people have difficulty coping alone after the COVID-19 outbreak in some countries. Considering this data, the anxiety levels are quite high, especially in people who stated that they were lonely. High levels of both loneliness and anxiety pose a risk for alcohol and substance use disorders. In the Green Crescent counseling centers, psychological support is also provided to alcohol and substance users regarding the accompanying mental problems. The center also developed an intervention program called COVID-19 Psychological Support Line. 100 psychologists were employed and providing telephone counseling and online therapy. The number of benefiters from this support by phone is 2,200 86, and from online therapy is 73. The Green Crescent Foundation won the Community Support Award with this project. Considering we are kind of like in the time limits, I pass it very quickly, but if you have any questions, I will be happy to answer in the end. So thank you for listening, and thanks again, Amy, for having Green Crescent in this platform.
Thank you. Thank you so much. And I did see that there were a few questions that were typed in the Q&A box, but it looks like the panelists have taken care of all of those. Thank you, Sadif, for that wonderful presentation and for all the work you're doing around the globe and all the different things that the Green Crescent is doing in the many countries. And thank you to all of our speakers here today. We are a little bit over, and I don't see any other questions in the Q&A box, but if anybody wants to reach out to me and send any questions, I'm happy to forward those on to our speakers. And I will follow up with everybody who was registered and send links to the great organizations that were part of this today, and some of the documents that they talked about, find some links for those so that you guys have those. Just thank you for being here. Thank you to our co-sponsors and for all the attendees. And I wish you a thoughtful and productive continuation of the CND. And I look forward to seeing you all in person, hopefully next year, as we continue all of our important work together. You guys have a wonderful rest of your day. And thank you again for being here. Bye, guys. Thank you.